Hi, my name is Brittany White. Today we're going to be going over my table clinic. I chose the topic of how periodontal disease is related to cardiovascular diseases. The reason I chose this project is because my dad suffered from a myocardial infarction last April, and periodontal disease is one of the risk factors that he had that caused his cardiovascular disease. So the first side that we're going to talk about is periodontal disease, because I split them up into periodontal disease on one side, cardiovascular diseases on the other, and then how they are connected in the middle. So first is that periodontal disease is a irreversible destruction of the periodontium, which includes the alveolar bone, cementum, gingiva, and the periodontal ligament. Periodontal diseases are an infectious communicable disease initiated by microorganisms and the dental biofilm, which collects on the tooth when self-care is inadequate. So when you're not brushing your teeth enough, you can have biofilm that can stick to your teeth, which in return causes calculus, and calculus can cause destruction of your bone. And P. gingivalis is the most common organism associated with periodontal disease. So some of the risk factors for getting periodontal disease is diabetes, tobacco use, stress, medications such as cyclosporin, phenytoin, and nifedipine, nutrition, and then your socioeconomic status. Some of the signs and symptoms are halitosis, which is bad breath, swollen red gums, bleeding gums, recession, tooth mobility, and then change in occlusion. Some of the treatments include an SRP, which is scaling and root planing, which is removing calculus supra and subgingivally. The root planing part is the smoothing out of the root surface and cementum to prevent easy adherence of plaque in future cases. Brushing twice daily and proximal cleaning. You're best to use floss at least once a day, but they have other adjunct aids that you can use, such as like a floss pick or a water pick or something, but you need to have some type of interproximal cleaning at least once daily. A balanced diet, and one of the main nutrients that needs to be included in a person that has periodontal disease is more protein, because it helps increase healing time. Also avoiding tobacco products such as smokeless, vaping, cigarettes, pipes, and then also to visit your dentist regularly. For most periodontal cases, it's every 3 to 4 months of a periodontal maintenance. And once your gingival health has been back to good standings, you can go back on a 6-month recall. And then for the cardiovascular side, dental hygienists need to take full responsibility to inform patients of the significant relationship between oral and systemic health, and the relationship between them two for the maintenance of healthy oral tissues and prevention of periodontal disease. So some of the risk factors are elevated cholesterol levels, lipid levels, and saturated fats, increased alcohol intake and calories, tobacco, diabetes, obesity, a sedentary lifestyle, increased tensions, emotional stress, and family history. All of these are significant alone, but when in combination, the risk factor is a lot more for the chance of atherosclerosis and ischemic heart diseases. So some of the signs and symptoms are chest pain, angina, shortness of breath, elevated plaque and cholesterol levels, and a myocardial infarction, which is also known as a heart attack. Some of the treatments include avoiding tobacco products, a balanced diet, which people suffering from heart problems should follow the American Heart Association diet, which is to eat a variety of fruits and vegetables, eat grains daily, eating fish at least twice a week, low sodium, trans fats, and saturated fats, and try to have a healthy weight. All of this information for the American Heart Association diet can be found on my plate. And you should also include optimum cholesterol levels, avoid high stressors, and then of course taking care of your oral health. And if you have suffered from myocardial infarction, it is best to wait 6 months for elective dental treatment. If it's an emergency, visit your dentist, but just for a regular routine cleaning, it should wait at least 6 months. So the link between the two, in one word, it's inflammation. Scientists know that inflammation leads to hardening of the arteries, which is also known as atherosclerosis. Atherosclerosis is a disease that causes your vessels to become smaller, making it harder for blood to pass through. With that, it also increases your risk of having a stroke and a myocardial infarction. Inflammation is a sure sign of gum disease. There are two main types. There's gingivitis and periodontal disease. The one that raises the most concern is periodontal disease. Your gingiva is very, very vascular, and with periodontal disease, the bacteria in your mouth and the toxins can travel from your oral cavity to your heart, which can cause problems. Not taking care of your oral cavity can cause harm to your heart. Researchers have found oral bacteria of the fatty deposits from atherosclerosis in the heart. Untreated, these deposits can narrow your arteries and break loose and clog them, causing a heart attack or a stroke. So for a visual representation of how all of this links together is that you have dental plaque, which you can also have cardiovascular plaque, but dental plaque leads to an inflammation of your gum tissues, which the plaque from your dental plaque can be found in your heart, which can cause atherosclerosis, and which in return can cause heart failure. This is my project. Thanks for watching, and I hope you have a good day.